This is Shelley Kraft coming to you live on SNNLive. We're at SEMDA, the Southeastern Medical Device Association 2014 conference right here in Atlanta, Georgia. With me, Dr. Christopher Reeves of Nichols-Reeves Enterprises. It's a private company. Dr. Reeves, welcome to SNNLive.
Shelley, thanks for having me on.
It's good to have you. Tell us what Nichols-Reeves is.
Nichols-Reeves is a company that was started by myself and Dr. Markia Nichols. We have a flagship product, the SurgGripper, that we're hoping to take to launch this year.
So tell me about the SurgGripper.
Yes, the SurgGripper.
I like that.
Yes.
Tell me what it does.
SurgGripper is a surgical instrument holder. Currently in the operating room, when the nurse is setting up the tray for the surgery, they just roll up a towel and they throw the instruments on the towel. They can fall off the tray and get lost, get damaged, infection problems. SurgGripper is just a semicircular, sterilizable piece of foam that has pre-cut slots in it that holds and secures the instruments wherever they are needed.
Are they numbered? Because I know that they're very critical of each and every tool, device, instrument in the operating room. Correct?
Yes, the counting is very important. It is not the slots are not numbered, but they can be grouped. So oftentimes they'll have several of the same type of instrument, and they'll group them, and this will allow for quicker counts before and after the surgery.
So, what is the real need for this?
The real need for this is to decrease the amount of instruments that are lost, damaged, infection control problems when if a surgeon is operating and an instrument that is needed falls on the floor. They either have to open another tray, which costs a lot of money, or they have to flash it in the autoclave, which can take time. And if you're a critical part of the surgery, that could be pretty detrimental.
So what's your background?
I'm an anesthesiologist, and Dr. Nichols is a OBGYN.
So you had your own experiences in the operating room, especially you witnessing all of the various different operations. You must have seen critical need.
Oh, absolutely. I mean, I can't tell you how many times I've been in the operating room and the instruments falls on the ground. You hear the surgeon say a few words, and then
encouraging, I'm sure.
Encouraging words, and then they have to. The circulating nurse has to scramble to try to recover another instrument or find some kind of alternative instrument for that patient.
What is the size of the market? And obviously, it's a future market. How is it done now? I mean,
Well, like I said earlier, currently the method and how these surgical technicians are trained is they roll up a towel. They literally roll up a towel, and they'll use multiple towels to do this, which takes time in terms of setting up a case. So if you have an emergency case, you can imagine that every minute counts is important. The market size is the size of every single surgery that occurs in the United States. There's roughly about 60 to 80 million surgeries in the United States, and this product could be useful in every last one of those.
Are you still practicing medicine, or have you just decided to do this full time?
Well, I am phasing out. I've kind of backed off clinical to dedicate time to the development of this product and taking it to market. We have a sales director, and we're ready to go.
How big is this market? And you're patented, right?
Yes, we're patented. We have a full utility patent that was issued back in August.
And how big do you think this market is in terms of dollars?
In terms of dollars, I'd say it could be $100, $200 million market.
And is it a crowded space?
We are the crowd.
I love hearing that. Ladies and gentlemen, let's get a website.
All right, it's www.SurgGripper.com. That's SurgGripper.com.
This is the Gripper, ladies and gentlemen. Dr. Christopher Reeves of Nichols-Reeves Enterprises. It's a private company. I'm Shelley Kraft. This is SNNLive. We're at SEMDA, the Southeastern Medical Device Association 2014 conference right here in Atlanta, Georgia. Thanks, Doc, for coming on.
Thank you.
Appreciate it.
Thank you.